Welcome to Political News and Views with Congressman Ed Towns of Brooklyn, New York, representing the 10th Congressional District, programming with your concerns in mind. And now, your host, Congressman Ed Towns.
Welcome to News and Views. I am delighted today to have with me Dr. Frank Folk. Dr. Folk is a board-certified surgeon and has been a friend of mine for many, many years. So I want to make full disclosure here. He has been a member of the Kinebrew Jewish Medical Center staff for more than 30 years and is attending physician at Downstate and Kings County Hospital. Dr. Folk is also a fellow in the American College of Surgeons. He is affiliated with many medical societies and health organizations and is known for helping people in Brooklyn who cannot afford medical care. I'm delighted to be joined by Dr. Frank Folk, who also served on the Health and Hospitals Corporation Board for many, many years and was able to do a lot of good things for a lot of people in New York City during those days as well. And we also have with us Damon L. Kinebrew, who is an entrepreneur who is the director of Advanced Technology Solutions Incorporated, a company that has facilities in Bedford-Stuyvesant and Dallas, Texas. Mr. Kinebrew is a member of the Urban League, Black Executive Exchange Program, and the Association of Minority Enterprises of New York. Welcome to News and Views. I am delighted to have you on, and I said I wanted to give full disclosure. Both of you happen to be friends of mine, but I am just so excited about the work that you're doing on behalf of people. And let me just get this chance right now. Let's move right ahead with the hospital closing, Dr. Folk. I mean, you served on the Health and Hospitals Corporation Board. Now they appointed the Berger Commission to look at our hospitals setting to determine in terms of what hospitals should be closed. Now, first of all, what are your views on the Bergen Commission?
My views on the Bergen Commission is that we need to have an analysis as pertains to the community. Take, for example, the eye, ear, and throat hospital in Manhattan. That hospital has been there ever since I have been in medicine, practicing medicine, because we'd send them over there to that hospital for expert help. As far as the other hospitals, I believe that hospitals should work within or stay within the community as the community asks for them. As far as the bed, what we used to do when I was down at the Health and Hospital Corporation, we would decrease the bed numbers. And so, therefore, the administrator, the CEO, then must deal with the economics. But I don't think you need to close the hospitals.
So you said rather than to close hospital, you're saying reduce the beds in the hospital.
Reduce the beds.
Right. Well, I mean, why would you just reduce the beds rather than to close a hospital?
Because the neighborhood uses the hospital, and believe it or not, for one of our constituency have to go a distance that word access. Mm-hmm. They will not take advantage of it, and so therefore keep the hospital in the neighborhood. And all these hospitals that they're talking about, they should stay in the neighborhood.
Well, in other words, the commission should go a step further by saying, looking at access to care, because, you know, what they're saying is that they're closing because in many instances, people use the emergency room, you know, as their physician, and of course, it costs a lot more to treat in according to them, an emergency room than it does if they would go to a private physician's office. Is there any advantages to that?
That statement irritates me to the ultimate, because why would you think that a patient constituency would go to an emergency room and sit down there for 4 and 5 hours? There got to be something wrong with that patient, and that patient is trying to live. So that's the only place that they know. If the patient got Medicaid, the doctors out there not going to take care of him. I'm one of the creeps at that. I may call myself a creep sometimes to take care of Medicaid patients for what they pays me. And then they're going to give me a headache about getting my money. And so therefore, I don't believe that people just go, that a patient should go to the emergency room when you don't have any access to a doctor. The first thing you call the doctor, and I have to get on my staff at times. If a patient calls up and says emergency, I will see the patient just right now. I will come in to see the patient. But the average doctor is not going to do that, and so therefore the patient does not have a place to go.
So you're saying that the commission then must look beyond just closing hospitals. They have to look at access to care. And what about the other issue in terms of the fact that in a doctor's office, certain kind of services in most cases cannot be provided. They don't have the x-ray facilities and all those kind of things. I mean, we're in a hospital setting, they have it. And patients, they know this. And so a lot of times they go to the emergency room because they feel that's a shortcut.
And another thing is, if I have looked at a patient coming into the emergency room, coming into my office, and said, brother, you're too sick for me to take care of you here. You got to go to the emergency room. Then I get on the phone, call the emergency room, and the patient goes over there because I don't have the acute lab studies. I can't get the acute x-ray studies. And as a matter of fact, I can't get an IV study. If the patient needs a transfusion, well, I don't have it in there. Now, yes, I know that 50% of the patients that goes to the emergency room may not need all this, may not need a portion of this. But the point is we have to take care of our patient.
Well, the other issue, Kinebrew, about disparities, health disparities, what can we do to prevent further health disparities?
Thank you for asking that question. That's one of my soapbox issues. I've been looking at healthcare disparities for a little while, and in several communities across the country. I was out in Tucson recently, where there are Native Americans out there. They, in some instances, don't have access to good health care because of where they are, the lack of doctors, lack of facilities. Back in the 10th Congress in central Brooklyn, and where I live and work, there is a disparity in terms of the ability to get adequate health care. And it's not maliciously done. It's because there are people who are making decisions on the health delivery system to the inner city where they live is not a problem. People in my community may very well use the hospital or the emergency room as their first source of care because that's all they have. However, I think that probably the initiatives that are taking place that would allow people to see the doctors, have access to hospitals, or ample medical care, those things are key. I agree with Dr. Folk when he said you need to keep the hospitals open, but you may need to reduce the bed size depending but you don't close the hospital because it takes too long to reopen the hospital. Too many people suffer. The hospital in my neighborhood, I've said to Doc sort of angrily that my neighborhood was better off in 1900 than it is in 2006 in terms of healthcare delivery in some areas. For example, the ability to the